So you can't sleep at night. You wake up, your hands feel like two balloons. You find that you're constantly shaking them just to start your day in the morning. You can barely brush your teeth, you can barely comb your hair, or you can't hold a phone to your ear to have a simple conversation because your hands are constantly numb. Well, have you consider you don't have to live this way, and what you may be suffering from is carpal tunnel syndrome. My name is Dr. Kraig Burgess. I'm an orthopedic hand surgeon here in Phoenix, Arizona with OrthoArizona. And what I just described are some of the most common symptoms that I hear people talk about when they're suffering from the most common compressive neuropathy that we see and treat as hand surgeons, and that's carpal tunnel syndrome. Carpal tunnel is a compression of the median nerve at the wrist. That nerve innervates these three fingers and a portion of your ring finger. And again, some of the most common symptoms I hear that people can't feel, they can't pick up change, they wake from sleep at night because their hands are just burning or they're on fire. To be honest, sometimes we just don't know. And contrary to popular belief, you don't have to be a typist to get carpal tunnel syndrome. Now, there are some medical conditions that can help predispose you or increase your risk of contracting carpal tunnel syndrome, and diabetes is one of those. Rheumatoid arthritis could be another. Well, first is getting an accurate diagnosis, and that's going to include seeing your healthcare professional, your general orthopedic surgeon, your family doctor, neurologist, or even your hand surgeon. It could be a physical examination combined with your history, and oftentimes we'll do additional testing, such as a nerve conduction evaluation or sometimes even an ultrasound exam. Once we have a definitive diagnosis, we can talk more about treatment options. Well, first and foremost, we always start with a conservative care, and most commonly employed is a simple carpal tunnel brace. And if you have any of those symptoms that I'm describing, then you could simply pick up a carpal tunnel brace at any CVS, Walgreens, or even Amazon now, and start wearing that at night. What that will do is it'll help neutralize your wrist, and it'll take that pressure off of the nerve and help you sleep at night. Second, we can offer anti-inflammatory medications that can help reduce pain, inflammation, especially for some of the secondary causes of carpal tunnel syndrome. Also, there are injections. And injections may not be right for you, but they honestly do a tremendous good for a select set of patients by reducing the inflammation around the tendons that indirectly takes pressure off the nerve and can help eliminate your symptoms. No, not necessarily. And that's part of the value of the nerve study. The nerve study can help to quantify and qualify the condition and help us understand maybe just how severe it is. And that's where you want to be able to talk to your healthcare professional or your surgeon to determine whether or not the conservative care or the surgical care is right for you. And for some individuals, surgery definitely is the best answer. Some people are actually predisposed to having some permanent nerve damage if they don't have the condition treated. So don't be one of those individuals who's stuck with that bad outcome that was potentially treatable by earlier or more aggressive treatment. From a surgical standpoint, if you reach a point where your conservative care has failed, your surgeon or I may propose to you that a carpal tunnel release is the next step. It's a minor outpatient surgery. It happens to be the most common surgery that I perform as a hand surgeon, and I do both a simple standard mini open approach or even an endoscopic approach. And I would be able to talk to you about some of the pros and cons to both. The simple approach is a small incision made over the heel of the hand, typically closed with 3 stitches. It's a same day in and out procedure. Sutures come out about 10 to 14 days later, and you can typically resume your normal activities within about 4 weeks. So if anything I've said resonates with you and you want to learn more, click the link below and allow me or one of my partners at OrthoArizona help you.